Every document, after a number of years, it must have a date on it when you're going to look at it and see what have we achieved, have the indicators been satisfied, what needs rewriting in the light of what's happened.
It's important to go on refreshing the strategy, saying where are we, what do we have to do now? And we did do a consultation throughout the year to get the feeling of people. That came back saying the 3 outcome areas, the prevention, provision of services right across eye health and sight loss, and on to making an inclusive society, are still the 3 right areas. So the focus is right, but all 3 of them, there's slight change in the priorities, in the direction, and there's going to be changes in the way we approach getting to those priorities.
It's refreshed in that there are some slightly different emphases. One is research being included. It always was a little bit, and the research priorities partnership work, which has been asking all the people affected by eye disease for them to say what they think their priorities are. So that has never been done before. So the research agenda will be led by the people who are affected. Without research, all the people that have got conditions that can't be treated, and that's 80% of children who are born visually impaired or blind, at the moment, no treatment. Well, without research, that huge group of people won't ever be able to be treated.
There's a lot more there about technology for people with sight loss, making sure there really is inclusive. Much more emphasis on making sure we really do think about the needs of children. We look at children's services, support for children. We look at making sure children have good sight. Much more about taking the wider aspect and attitudes to public health. Public health has really gone up the eye health agenda over the last 5 years, and that's reflected in the outcomes. Targets have still got to be really fined up. So we've got the strategy, we know where we want to do, but the monitoring plans and the actual action plans, which will have the specific time-limited targets, still have to be agreed. We need to make sure we do, don't we? As a sector, it's not me, it's not you, it's as a sector, we can do it. The strategy is labelled 2013 to 2018, so we have committed ourselves already that in 2018 we will need to revisit and say where next.